world, it's time to get inspired. Warmest welcome to World Humanitarian Drive's 14th episode of Inspiring Millions Show. This is the show where we feature brilliant minds from around the world to share with us their story, one story at a time. Today, our honorable guest is Dr. Agnelo Fernandes, Chair, NHS Croydon Borough. We'll get to know his inspiring story in a short while. Thank you for joining us, live or in replay. I'm Viva Andrada O'Flynn, your host and Global Media Relations of World Humanitarian Drive. World Humanitarian Drive, also known as WHD, is an international NGO with global operations in 12 countries, founded in Croydon, UK by British Indian global peace activist, entrepreneur, writer, Dr. Abdul Basit Saeed. The primary vision of WHD is to promote peace, education, and trade harmony initiatives globally among everyone across the world, regardless of race, gender, religion, or nationality, living as one family. On this Inspiring Millions show, we encourage you to engage with us. Please help us spread inspiration by sharing this link. We would love to hear from you. Put your questions that you would like to ask our honorable guest, Dr. Agnelo Fernandes, or comments that you have for us in the chat box. We will read them later on in the show. Let us also know where you are watching this. Wherever you are in the world, let us keep you company and brighten your day as we share peace, love, and goodwill. It's the 5th month of the year. May is Mental Health Awareness Month. With COVID-19 drastically affecting the world, it's taking a toll on people's mental health. Essential workers on the front lines put their lives at risk to save and protect others, even at cost to their physical, emotional, and mental health. This week is also Nurses Week, when we celebrate and acknowledge the important contributions that nurses give to society, especially in these times. For this Inspiring Millions Show episode, our honorable guest knows full well about the importance of nurses and taking good care of one's mental health. Dr. Agnelo Fernandes is a GP in Thornton Heath, Croydon. His interests include minor surgery, dermatology, and quality improvement of health services through innovation and transformation. He is a GP trainer and appraiser, a member of the Croydon Local Medical Committee, and a governor at Royal Russell School, Croydon. Dr. Agnelo is also the chair of National Health Service, NHS, England's Pan-London NHS 111 Clinical Governance Group, the National GP Lead for Urgent and Emergency Care for the Royal College of General Practitioners UK, and chair of the National Intercollegiate Clinical Governance Group for NHS Pathways. He was awarded the MBE, Member of the Order of the British Empire for services to medicine and healthcare by Her Queen Majesty, the Queen in 2004. Fellowship of the Royal College of General Practitioners in 2006, and his practice attained the highest honor of the Royal College of General Practitioners Quality Practice Award in 2010. And recently, Regal British Award for his outstanding services during the pandemic, and Grand Saviors Award in behalf of NHS, awarded by World Humanitarian Drive. In his role as a GP Borough Lead for Croydon, Dr. Agnelo chairs several groups, including the Urgent Care Working Group, Strategic Transformation Board, and Prevention, Self-Care, and Shared Decision Making Steering Group. He is also the Vice Chair of Croydon's Health and Wellbeing Board. Let's all welcome Dr. Agnelo Fernandes. Welcome. Thank you so much for joining us here today.
Hello, Viva. Nice to be here.
Hello, Dr. Agnelo. We are very honored that you could join us today. Could you please give us a brief background about yourself and introduce to the world in your own words who is Dr. Agnelo Fernandes?
Thank you, Viva. So I have a long checkered history. As you can see, my hair is a bit grey now, so I've been around for a little while. I was actually born in Goa. and lived there for the first 4 years of my life. I don't remember very much other than chasing butterflies and the wonderful beaches. Um, but after my father died, my mother and my brother moved to Africa, to Kenya, and we lived in Nairobi uh, for another 7 years. And after that, my family moved to England, and I went to school in London, in Wandsworth, and from there to university at King's College London and Westminster Medical School. Following several mergers of medical school, I qualified from Charing Cross and Westminster Medical School, and then went on to do my internships in and around London, and the last of which was in Croydon, and that's where I settled and became a GP in 1990. So it was a long journey, and I consider myself not of one country but of several countries. So always already feel as part of the world rather than as part of any single country.
Dr. Agnelo, so you've taken us on a journey on the things that you've been doing and where you've come from. What are the important lessons that you've learned in your life's journey so far?
So the key lessons for me is never think negatively, always think positively, because the glass is always half full, it's not half empty. If you think negatively, you will never make progress because you always see everything as a problem. But when you think positively, you'll see the opportunities. And there are always opportunities that are there to be had. And that's really key, important lesson to be had. And the other is, it's not about you or me, it's about us, it's about we, and working with other people, connecting with other people uh, uh, helps deliver some of the changes. So it's really important to listen to other people, uh, walk in their shoes, because people go through lots of different experiences in their lives, and unless you understand them, it's very difficult to understand what they're going through. So I think in my profession as a GP, as a family doctor, really privileged to know people over a long period of time, know them, know their children, and sometimes even their grandchildren. So over decades, so you build a special relationship with people and a special trust, and people still call on you and say, "This is what I've heard, this is what I've read, but I want your opinion. What should I do?" And I think that puts you in a really strong position of trust, but also one where you can't afford to make a mistake. Because you have to give people the advice that you think is right, because they trust in you so much. So I think my role has helped me understand that things can only be positive if you think positively. If you think negatively, then that ends up going down the wrong path.
Those are important life lessons. I'm sure our viewers have learned a lot from that. So it's been quite a challenging year for medical practitioners uh, with COVID. We would also like to know, how does a working day of a GP and chair of NHS Croydon Borough look like? Could you please give us a picture of the different tasks that you do in a day?
Yeah, so my week is split up into clinical work. I think it's really important to be on the ground to see and feel and experience what other people, other health professionals, and other GPs and people that work in the NHS experience. Because once you lose that experience at the front line, one you actually become a bit blinded, and you also you lose credibility with your workforce. So it's important to do the clinical work, actually seeing patients. Um, Over the pandemic, we've been working differently. We've been working more remotely, wearing PPE, wearing scrubs, not wearing our normal clothes, going home and washing your scrubs when you've seen people, actually also doing video consultations. So the digital consultations have been much greater as a change in the way we've interacted with people. And the whole reason for this has been to try and avoid having crowded waiting rooms. Because if you've got crowded waiting rooms of people walking, then there's an increased risk of transmission of the virus. So the vigilance in terms of preventing transmission has influenced how we work, and it's been a huge change. In fact, general practice as a GP at the beginning of the pandemic in March in the UK, the way we work changed in 2 weeks. And some of those changes were being debated for years before and didn't happen. But actually, when the pandemic struck, it only took 2 weeks for the way we work to change. So I enjoy that frontline patient contact role. I enjoy my teaching role as well of postgraduate doctors who are training to be GPs. And I try to instill on them about making decisions based on what they see and hear and examine, not what anybody else has said. I think my buzzword is, even if God has seen the patient before, make up your own mind, because it's reliance on your instincts and developing your instincts as a doctor that is really important based on the evidence that you have in front of you, because things change and it's important to be able to do the right thing by patients. The other thing I try and do with my trainees is to inspire them to take on leadership roles. Uh, um, being a good doctor is not just being in a consulting room. You become a better doctor when you actually can see the bigger picture, and you can help people by changing the system around them. If all you do is see patients and not change the system, not have the opportunity to change the system around them, you can't improve things. So seeing patients and being able to change the system and influence the system actually helps patients and better outcomes for them in their healthcare. So I encourage them wherever possible to think bigger, think outside the box, and actually think about how they can develop their own leadership styles and leadership skills, and think of developing portfolio careers, doing a little bit of different things, which actually enriches them. Often we feel that the workload is so much we can't cope. But if you want something down, there's an old adage that says, if you want something done, ask a busy person. Because there's one thing that you learn if you're doing lots of things, is you manage your time more effectively. So that time management bit is really important. And so being involved in the politics and the management side of things in terms of Croydon and the NHS commissioning group in Croydon and in South West London actually gives you a different dimension, because if there is a budget, how is it going to be spent? What's the most effective way of spending it to get the best outcomes for patients? And as always, there's never going to be enough money around. How are you going to make best use of the resources you've got? And so being able to relate back to the front line and what does that mean to patients and what changes might actually improve things within the resources you got is really, really powerful. And that connection with the front line is important to be able to do that more effectively. And it's real time, because 1 minute you're in the front line with the patients and the next minute you're in a high level meeting deciding on how to spend millions. And then you take it to the next step, beyond Croydon, beyond South West London, across the whole of London. What can you do that does influence millions of people and has an impact on improving things for the millions of people? So the 111 Integrated Urgent Care governance group that I chair looks at the quality of 111 services across London. And 111 is the number that people are encouraged to ring if they have a problem and they don't know what to do. And 111 can do an assessment and be able to direct them or even book them into different services if that's what they need, or advise them on what to do, whether it's something they can take care for themselves or see a pharmacist or see a doctor, or needs an ambulance, or go to the emergency services. So that perspective of seeing millions across a region and making a difference is really quite powerful, because you come home and you think you made a difference. And that theme of making a difference, whether it's the front line, whether it's in your locality, whether it's in your region, actually gives a lot of pleasure and a lot of pride in terms of what you're doing. And you're working with different teams, and they take a pride in what they're doing. And then you start working in the same week. You might be in a national meeting where you're impacting on the whole country in terms of decisions that you're being made. But at the same time, you're not losing the impact on the patient at the front line, or the impact at a regional level, or at a provincial level from a Croydon perspective. So working at different levels all at the same time actually gives you a unique perspective of how you can influence things and how you can improve things going forward, and actually gives you a voice that a lot of people don't have, but also a vision that a lot of people working in any one of those areas may not have. And that making a difference bit is my driving force, really. Is, how far can you go? Every day do you make a difference? And GPs are under a lot of stress, and because of the increasing workload and long hours. And I say to my trainees, who will be GPs in a year after their training, is that we hear about the burnout of GPs because of all the stresses. And they say to me, why do you not worry about that? What's been different in the way you've approached things? And I say to them, from the time I leave my consulting room and I start walking to my car, I think, have I made a difference to one person? And after a long day's work of seeing lots of people, there hasn't been a day in the last 31 years where I can say I've not made a difference to one person. And if that's been the case at the end of the day, and I think, oh, that's all right then, and that's my stress gone, and I go home, I drive home, and I'm not worried about thinking about all the other things that were not so nice about the day. So it's about thinking positively, thinking about where you can make a difference, how you can make a difference, and at the end of every week, working at different levels in the system, actually you feel that you have made a difference somewhere, and that's what keeps me going to the next week. But it also means that I can have my weekend off and actually do other things, but reflect on how you could do other things better.
Thank you. You've let us know all the many things that you're doing. So you have so many tasks and responsibilities. What we'd like to know is, how do you manage to accomplish them all?
Um, I don't I don't think about them. That's the reason I think I've managed to do so many things at the same time. But the reality is that they're all linked in some way, and that's the golden thread that goes through them all. Is that because they're all linked and all connected, then you're able to do one thing at a time, but all at the same time. Uh, um, uh, and at the end of the day, actually create something that is more connected than it was before you got involved in it. And it's all about people. And each part of the tasks, or each part of the system, has a different range of people with different skills. So being able to work as part of those different teams is a real opportunity, and is I'm grateful for being able to work in all those different teams and learn from them, as much as being able to contribute to them. So it is about the we, it's about the system. It's not about any individual, but it's about individuals being able to contribute to the greater good and make a difference, rather than just being in meetings where you talk and not make a difference. So I'm really keen on doing and having outcomes rather than talks for talk's sake.
We also, well, because you're doing so many things, and other people, when they do that, they get overwhelmed and they get anxiety as well. We have a question from Win in the Philippines. Win from the Philippines. She would like to know, how do you control anxiety? Is it only in the person's head?
Well, I think anxiety manifests itself differently in different people. So it's important to realize when you feel that the steam is coming out of your ears, and there have been times when that's happened because there is so much going on, or so many things that you're not in control of. So I think you become more anxious if you feel that you're not in control. So it's how do you get back into control? There are going to be some things you'll never be in control, but then why worry about it? There are going to be things that you were in control before that you're not in control of, and that's something you can do something about. So during this difficult time, there's a lot of anxiety with COVID. Everybody's been affected in some way. I mean, if nobody's been affected, then they must have been living on a different planet. So wherever you are, whether you're a citizen, a patient, a relative, a healthcare worker, a manager, everybody's been affected because we've had the shutdowns, businesses have been affected. We've had, and certainly in Croydon, we're nearly approaching 1,000 deaths now. Thousands more people that have been that suffered COVID directly, and also now we've got people with what's called long COVID or prolonged symptoms related to COVID. So everybody's been touched in some way, and there is anxiety, and there is mental health has come to the fore, and so we need to recognize there is that anxiety, and my way of trying to rationalize it and prevent it overwhelming me is what is it that I'm not in control of, and that I can change to be back in control that I wasn't before. And the powerful part of this is to talk. So talk to your family, talk to your spouse, talk to your wife, talk to your friends, talk to your colleagues. I think a problem a problem shared is a problem solved. So the power of talking is really a critical part of controlling that anxiety.
So you're also a GP, and what would you like to advise people to stay healthy and safe in these times?
So I think the most important thing is to try and prevent prevent getting prevent yourself being at risk of getting COVID in the first place. So we know, and we're fortunate in England at the moment, the number of cases have gone down, but it's not the case everywhere in the world. And we know that the tragic situation in India, but in the UK, we're at an all-time low in terms of infections and hospitalizations and everything else. But it doesn't mean to say the pandemic is over. The pandemic is not over till everyone in the world has got that solved. And so at this moment in time, to stay healthy, make sure that you have a proper diet, exercise, make sure you drink lots of water. A simple thing like that, people don't realize is really helpful. Um, Talk to your friends, talk to your relatives, keep your mental health in scope. Don't assume that you're going to be strong and that you're unbreakable, because we're all breakable. Acknowledge that if there is stress and anxiety, which may manifest itself in a number of different ways, whether it's your sleep, or your dentist notices all your teeth broken because you're grinding them in the night, or uh, you know you find it difficult doing what you did before. Um, Talk to somebody. Uh, Talk to, whether it's your GP, or talk to your other services that are available directly for patients. And there's nothing more important than recognizing that we're all human, and that we are going to be affected by everything that's happened to us. So if you start from that point, if you don't need more help than talking, then at least you'll be in a good position to access it.
Thanks, Dr. Agnelo. So you've had COVID already. You've suffered from COVID. What was it like for you?
So the one thing doctors and nurses think is it'll never happen to us, and it did. And in my 31 years as a GP, I've not actually been a day off with any minor illness. with any colds or flus or anything like that. And I rang up my practice on a Friday to say I don't feel well, and they said, well, you got a bit of a cough, and my cough wasn't actually that bad. And I said, well, I can come in because we're short of staff. And they said, no, don't come in. Go and get a COVID test. And it was actually my manager that told me that, not another doctor. And so I went along, had a COVID test, not expecting it to be positive. Next day, which was Saturday, got the result on my phone as a text to say it was positive. By that stage, I was getting stronger and stronger symptoms of COVID infection, my body aches, my breathing, and everything else. And over the next 3 or 4 days, things were getting worse and worse and worse. Knowing what to expect, my oxygen saturations were variable, and I was getting worse. And the last thing doctors want to do is be a patient. And actually, it was my wife who called the ambulance, and that's the first time I've been in an ambulance as a patient. I didn't know what day it was. I didn't know where I was, and went to hospital. For me, it was a real eye opener. For one thing, I could feel every bump in the road in an ambulance. The second was actually, is this really happening? And then I thought to myself, what happens if this goes all the way and I don't actually come back? Have I kept all my things in order? So all these thoughts go through your head in those circumstances. But as it turned out, I didn't need to go on a ventilator. I was treated and got home, but it meant I was 5 weeks off work. Had to learn to walk. Had to learn to talk effectively because I was so breathless. And for me, the big lesson of this is that it can happen to anyone. You can take all the precautions, and it's really important that the message about washing your hands regularly, wearing a face mask is really important. Making sure you're in an area of fresh air, and keeping space with people is really important. So those public health measures are critical as a basic. The second was, you always think, where did I get it? And actually, I know for certain I didn't get it from the surgery, because seeing patients, you're always in PPE and you're always following all the advice because you're in professional mode, but you let the guard down when you're in normal person mode. And that's where it's likely to have happened. And it's likely to have happened at the same time where I was with my wife, because she tested positive the next day. So it must have been somewhere where we were together. But her reaction wasn't as strong, and she recovered a lot more quickly. But I was off for a while, and I'm still not recovered because I've got symptoms of long COVID, which means that your muscles are really tired. In my case, my smell hasn't returned, my taste hasn't returned. So the lesson for me is to try and get that message across to people. In the first place, don't get COVID if you can help it. Take every precaution. And the second thing is get vaccinated. So the key message that I've been trying to do, work with all our communities, is about increasing the vaccination rate. And in the UK now, we're going to the 40s and above. So we've done really well in terms of vaccination, but we've still got a cohort of people who are vaccine hesitant, especially people of Black and Asian origin. Even though we've made huge improvements in the uptake, there are still people who do not want to have the vaccine, even if they're offered it. And it is by slow encouragement and by explaining to people the benefits of taking the vaccine that you can get the message across. So I've had both my first dose of the vaccine and my second dose of the vaccine as well. And we know the evidence is building up that not only does it prevent you from having serious illness and hospitalization and death, but also in terms of reducing the spread. So the encouragement to people is, it's not only to protect you, it's to protect your family and your friends, but it's also important to protect your community. reduce that spread. So it's a really critical message that we're still working on. And I've been on numerous webinars with lots of different groups of people to try and get the message across. And part of the hesitancy is based on misinformation. And there's been a lot of misinformation on WhatsApp. I know I've been sent some from my own family, which has been circulating. So if you see something, please don't forward it. It's easy to forward videos and all sorts of way out things. Go to trusted sources to get the information that you need. And social media is probably not the best place to get kosher information. And if there's one lesson is, do not think of other people. Do not forward that video that you think looks quite, asking things that you've not heard before. Ask trusted sources to get the facts. And I think, the key element of helping us get out of the pandemic is the vaccinations, as much as keeping all those public health measures going as well. We know that over this last winter, we didn't have a flu pandemic or flu epidemic because actually everyone was following public health guidelines and they were wearing masks, they were washing their hands, and they were keeping social distance. So the advice wherever we are in the world is do the public health measures, but also get vaccinated when your time is when it's time for you to do that and when it's available to you. And I think the message to the world is we need to accelerate that vaccination program, make vaccines more available to every country in the world, and so that it's not just more prosperous nations that have access to the vaccine, because none of us are safe until we're all safe, and we can only be all safe if the majority of people on the planet are vaccinated, and the sooner the better.
So, Dr. Agnelo, you've had COVID and you've still taken the vaccine. Should people who have had COVID still take the vaccine?
The answer to that is quite simple. The answer is yes, because if you've had COVID, you develop antibodies, but I think the studies show that the antibodies wane with time, so it may be about 5 or 6 months. But with the vaccination, the antibodies to prevent an infection or to prevent serious infection in the future is actually a lot longer than that. And with just with the first dose, and with the second dose, it's even more stronger. So my advice, and I've already practiced what I'm saying, is even if you've had COVID, have the vaccine.
So, there are also COVID variants spreading. Will the current vaccines work against them as well?
So as far as we know at this moment in time, they do. And so it's still important to make sure that we have the vaccine. And I think the other point that people worry about is safety. Crossing the road is more dangerous than having the vaccine. We hear about all the potential side effects, but these are very rare side effects. And so follow the guidance from wherever you are in terms of your national bodies, and have the vaccine. But in terms of side effects, and the serious side effects are extremely rare, and nothing is without risk. But the risk of COVID is worse than anything else. And the risk of COVID, and if you've got long COVID afterwards, which affects every organ in your body, is far greater. Therefore, important that we have those vaccines going forward. And I think in terms of the message about vaccination to get across to people is it's safe, it's effective, it is an avenue to help us get out of this pandemic. And if you're offered it, whether you've had COVID or not, is to have it.
Dr. Agnelo, you are the recipient of numerous awards. You were awarded the MBE for services to medicine and healthcare by Her Majesty the Queen in 2004. What was that experience like for you?
It was just amazing. I think the whole day, being going to Buckingham Palace, walking through the corridors of Buckingham Palace, through all the grand rooms, seeing the pictures as you're being ushered through different parts of Buckingham Palace, and then actually waiting to be presented to Her Majesty, and seeing your wife and seeing my mother and my uncle in the audience, brought a tear to my eyes, really, in terms of, if my father had been around, he'd have been so proud at that moment in time. But it was good for my mother and good for my family to be there to witness that, and it was very surreal, and Her Majesty was amazing, and I will never forget that moment, and the brief conversation. So yeah, wonderful.
What was your brief conversation about?
Was about, uh, what you were doing and what you'd done, and what would you like to do.
That's very amazing experience. So, World Humanitarian Drive has an Honoring the Honorable initiative to recognize achievers for their various contributions by honoring and awarding them. You are the recipient of Regal British Award for your outstanding services during the pandemic, awarded by World Humanitarian Drive. In your opinion, how important is this initiative to give recognition in these times?
So I think the fact that it's one person or to an individual, it's not the individual. It is it's a recognition of everybody that's been involved in everything that I've been involved in, because it has been the effort of thousands of people and hundreds and thousands of people that has helped bring us to where we are today, in terms of the effort against the vaccine. So it's the people who've been delivering the vaccines, the people that have been actually running the vaccination sites, the people that have been working in the hospitals, looking after sick people, and been through really difficult times. People coming in and people dying, people getting better. The emotional part of that has been a huge burden on the staff, the nursing staff, the doctors, the cleaners. So when we look at this award, it's on behalf of all those people, and not to forget the people that are involved in the catering, and the people that have had to go to work. And I often say to my wife, somehow it doesn't feel as though my work has changed, because I'm still going to work every day, doing what we've always done. We wear scrubs, we work differently, we don't wear our own clothes, but actually, you know, everybody's been in the health service and the care service has been going to work, doing what they normally do, and so it is a recognition of everybody's effort in what's gone on, which is a really positive thing. You know, everybody needs a pat on the back sometime, because often we don't acknowledge the successes. We focus on the negatives of when things don't go right. We need to say sorry when that happens. We also acknowledge when things have gone right and say thank you to people. And I think that is a mechanism of doing just that, and recognizing the efforts of everybody involved in the program. And the Grand Saviours Award takes it further afield, rather than just in terms of the NHS. It's also the care service, people in the council, the people that delivered the food parcels, the volunteers that worked in vaccination centres, uh, the neighbours who helped neighbours, the people that worked in the stores and the supermarkets to make sure there was food available for people, and also all the public who listened, who followed the public health advice, who came through, who kept to lockdown rules, uh, who came out to clap for the carers, who supported the system to win the battles against the virus. So it's a recognition of all those people, not just in healthcare. And as a community, and as a community in Croydon, it's a recognition of how we worked together, the public, the health service, the care service, the volunteers, and to come through this. So from that point of view, I think it is the recognition of the whole community, and I see very much see that as a positive thing. And again, saying to a community, you've done well.
Awards are a way of recognizing everyone's efforts. So it's Nurses Week. What message would you like to tell nurses of the world?
So nurses have come to their fore during this last year. Not only have they dealt with the physical side of things with COVID and intensive care in the post-COVID wards, in the hospital, they've been the emotional support to so many patients when they couldn't see their families. They've been there when people have passed on to support their families. But we must remember all the nurses who have worked outside hospital as well. And more people with COVID have been looked after outside hospital than in hospital. And managing not only physical and mental illness, mental stress of the patients they're looking after, but also being there for the families has been something that, you know, the nursing profession is entrenched in terms of the way they work. And we need to acknowledge the efforts of nurses everywhere. And not only the nurses, but also midwives who've been key in terms of keeping people, people haven't stopped giving birth, but, people have been giving birth in a world that was slightly different. So we need to acknowledge all the nursing profession that have been involved in this last year, but also for going the extra mile, because they've all gone the extra mile and they've all experienced the emotion of this last year. And we need to say a big thank you to them for what they did before the pandemic, but also what they did during the pandemic up to now in supporting their fellow human beings. And so I say to them, thank you.
Thank you for that wonderful message to nurses around the world. Well, Dr. Agnelo, well, we've got viewers from the Philippines, India, Malaysia, and Bhutan as well. And we have a question from Tongi Gra, and he's asking, what types of home exercise do you recommend, as some of us are confined at home?
So there's a lot of exercise you can do at home. If you've got a garden, you can certainly walk around the garden. If you're indoors, you can do exercises of Tai Chi type movements. You can do exercises using a elastic band. You can do exercises lying down. You can do exercises in terms of stepping exercises. You can go up and down stairs. There's a huge range of exercises you can do for all parts of your body, even if you're indoors. And if you've got somewhere outdoors to go to, even though you're confined to your home and your precinct, then there's even more you can do. But the important thing is exercise keeps your body going, keeps your circulation going, keeps your mind active, helps reduce your stress. So it's really important that you do some form of exercise, even if you're confined to home. In fact, I would say it's even more important that you do something if you're confined indoors to get the joints going.
Thank you for those wonderful tips about exercising at home. And we have a message from GP Dore Sami Govin Sami, and he said, Dr. Agnelo Fernandes is a great humanitarian, wonderful presentation. So here's our final, thank you. Here's our final question. What is your inspiring message to the world?
So I think for me, it's about keeping your faith, whether it's religious, whether it's in your fellow human beings, but having a faith positively that that you can make a difference. So having a faith is really key. Looking forward to doing better, to having hope, because there's nothing worse than not having hope and just thinking of despair. Because out of every tragedy, there is a silver lining that you can look back on and build on to build on the future. And the other is we're not individuals. We're not alone on this planet. We're part of a community, whether it's our family, whether it's our friends, whether it's our locality, whether it's our country. And now, with the pandemic, even more so, the world and the planet. So it's about community. So it is about thinking about not self, but everybody. And we're all connected. And that whatever we do, and the pandemic has brought it home to us, is that we can only do it together. We can only survive as a human race together. We can only save our planet together. And that part of community is really a key part. And the final message is we need to make a difference and continually think about how we can make a difference. And to my medical colleagues and students, think about how you can develop as a leader to make a difference, not only to the patient in front of you, but also in terms of on a wider footprint. Because it's only when you develop that leadership in our youngsters going forward, the future will be much brighter for everybody.
Thank you so much, Dr. Agnelo Fernandes, Chair NHS Croydon Borough, for honoring us with your presence, sharing your inspiring story, tips, and words of wisdom. Thank you for joining us here today, Dr. Agnelo Fernandes.
Thank you. Thank you, Aviva.
Thank you so much. We would like to share an inspiring quotation by Leo Buscaglia. Too often we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest accomplishment, or the smallest act of caring, all of which have the potential to turn life around. During the season of COVID-19, we realized the importance of every worker, essential jobs that we may have taken for granted in the past. They are what keep us going in these times. To our frontliners, our modern day heroes, we salute you. We thank you for your hard work, sacrifices, and dedication to humanity. This has been World Humanitarian Drive's Inspiring Millions show. If today's discussion inspired you, please like it, share it, drop us a comment. Follow us in our social media accounts. Click subscribe on our YouTube channel, WHD Media. Visit our WHD website, www.whd.org.uk for more inspiring events. Stay safe and healthy, everyone. On behalf of WHD, especially those working behind the scenes, WHD Chairman Dr. Abdul Basit Saeed, WHD Director of Global Operations, Ms. Sarah Wilson, WHD's 12 Honorable Secretary Generals, we thank you, our virtual audience from around the world, for joining us. To our Muslim family and friends, as Ramadan ends, we greet you Eid Mubarak. Happy Mother's Day on Sunday. To my mom and all the moms of the world celebrating Mother's Day, we thank you for nurturing and guiding us to be the best we could be. It's also Europe Day on Sunday. Happy Europe Day. To all those celebrating their birthdays and special milestones this week, happy celebrations. Have a wonderful weekend, everyone. I'm Viva Andrada O'Flynn. Please join us again next Friday as we inspire the world here on Inspiring Millions Show.